Welcome to this presentation on the State of Colorado's Mental Health Parity and Addiction Equity Act analysis performed by the Colorado Department of Healthcare Policy and Financing. The Department of Healthcare Policy and Financing administers Health First Colorado, Colorado's Medicaid program, and the Children's Health Insurance Program in the state of Colorado. The mission of the Department of Healthcare Policy and Financing, also referred to as the department, is to improve healthcare access and outcomes for the people we serve while demonstrating sound stewardship of financial resources. In this presentation, I will provide a brief overview of the Health First Colorado, Colorado's Medicaid program, delivery system. I will also provide an overview of the delivery system for Children's Health Insurance Program, known as Child Health Plan Plus or CHIP Plus in Colorado. I will then talk about the federal laws and requirements surrounding the Mental Health Parity and Addiction Equity Act, also referred to as Parity. From there, I will discuss the department's internal process for conducting our analysis and determining compliance with Parity. Finally, I will discuss how to provide feedback to the department regarding Parity. For Health First Colorado, most physical and behavioral health benefits are administered through the state's Medicaid managed care system. The department administers the Community Behavioral Health Services Program, a statewide program that provides comprehensive mental health and substance use disorder services to most Health First Colorado members. Members receive these services through an assigned behavioral health organization known as a BHO. There is one BHO serving each of the state's 5 regions. In addition to a BHO, most members are enrolled with a primary care case management entity known as a Regional Collaborative Care Organization, or RICO. The RICOs provide care coordination to members and also help members find community services in their area. Most members receive their physical health services through their RICO. In certain areas of the state, members can choose to receive their physical health services through a full-risk managed care organization known as a MCO. Members served by a MCO receive their behavioral health services through a BHO. There are 2 MCOs serving roughly 130,000 members. The state plan is the document the department uses to describe services available through Health First Colorado and CHIP Plus. When the state of Colorado chose to expand Health First Colorado coverage under the Affordable Care Act in 2014, it did so through an Alternative Benefit Plan, or ABP. Members who became eligible for Health First Colorado through the expansion are covered by the ABP, which offers the same benefits as the state plan. Members that are covered by the ABP receive services through the managed care system. Members who need specialized care beyond state plan services may qualify for a home and community-based services waiver, referred to as HCBS. Members in an HCBS waiver may also be enrolled in a managed care plan. Colorado's CHIP Plus plans are classified as fully comprehensive MCOs, which means they offer both physical and behavioral health services. There are 5 CHIP Plus MCOs in the state. The Paul Wellstone and Pete Dominici Mental Health Parity and Addiction Act of 2008 is the federal law that requires this analysis. The final rule, published in March 2016, can be found in the Federal Register at 42 CFR Parts 438, 440, 456, and 457. In 2013, guidance was provided to the states from the Centers for Medicare and Medicaid Services, or CMS, that confirmed the application of Parity to Health First Colorado and CHIP Plus plans. Each state must publish an analysis showing compliance with the rule by October 2, 2017. In states where both physical and behavioral health services are not offered through a comprehensive MCO, like Colorado, the state must conduct the analysis to show compliance with the parity rule. As Colorado's CHP Plus plans are fully comprehensive and provide both physical and behavioral health services, each MCO was responsible for conducting their own parity analysis and reporting the results to the department. The following two slides from CMS provide an overview of the requirements for parity. Parity requires health plans to ensure that financial requirements and treatment limitations applicable to mental health or substance use benefits, referred to as MHSUD benefits, are no more restrictive than the predominant financial requirements and treatment limitations applied to substantially all medical and surgical benefits covered by the plan. Financial requirements include co-payments, co-insurance, deductibles, and out-of-pocket maximums. Treatment limitations here are referring to quantitative treatment limitations, which includes limits on scope or duration of benefits expressed numerically, like visit limits. While not on this slide, it is important to note that parity also requires that an aggregate lifetime or annual dollar limit cannot be applied to MHSUD benefits unless it applies to at least 1/3 of medical and surgical benefits. Parity also requires health plans to not impose a non-quantitative treatment limit, referred to as an NQTL, on MHSUD benefits unless the processes, strategies, evidentiary standards, and other factors used in applying NQTLs are comparable to and applied no more stringently than the processes, strategies, evidentiary standards, or other factors used to apply the NQTL to medical and surgical benefits in the same classification. NQTLs are limits on the scope or duration of benefits that are not expressed numerically, such as medical management standards or fail-first policies. What this slide means is that while NQTLs may be applied to a behavioral health benefit, the rationale for applying the NQTL must be similar to the rationale for applying an NQTL to a physical health benefit. The NQTL must be applied no more stringently to a behavioral health benefit than a physical health benefit. While the law does strive for equal access to behavioral and physical health services, it does not require all behavioral health services to be provided by the state. The parity rule does not require a MCO or BHO to provide any MHSUD benefits beyond the scope of its contract. This means that this rule does not require Colorado's MCOs and BHOs to provide a MHSUD benefit that is not found in their contracts. The rule also does not require a MCO or BHO that does provide MHSUD benefits to provide additional MHSUD benefits because of the rule. Federal regulations also do not require any specific MHSUD benefits to be provided through an ABP. This slide from CMS shows the steps the department followed to conduct the parity analysis for Health First Colorado. The department identified the benefit packages for which the parity rule applies, defined the benefits and conditions for which parity applies to, mapped the benefits to the 4 classifications, identified and analyzed financial requirements, quantitative treatment limits, and aggregate lifetime and annual dollar limits, identified and analyzed NQTLs, analyzed the availability of information, and finally, document our determination of compliance for public posting. In order to conduct the analysis, the department held weekly meetings with an internal work group comprised of subject matter experts in programs, policy, benefits, long-term services and supports, finance, and data analytics to work through each step and requirement for compliance. The CHP Plus MCOs were responsible for conducting their own analyses and also followed these steps. The first step in the parity analysis was to identify the affected benefit packages. The final rule states that parity applies to members covered by a Health First Colorado MCO the ABP, and CHIP Plus. Even though the MCOs only cover 130,000 members, the department wanted to ensure similar access for all members. The next step in the department's analysis was to define the benefits and conditions covered under Parity. The department uses standard definitions reflected in state rules and regulations. A behavioral health benefit treats a mental health or a substance use disorder condition. A medical surgical benefit treats a medical condition that's not a mental health or substance use disorder condition. After the department defined the benefits and conditions affected by Parity, the department mapped each benefit to the 4 benefit classifications identified by CMS: inpatient, outpatient, emergency, and pharmacy. The benefit map for Health First Colorado services can be found on page 4 of the analysis. Per CMS guidance, ABP benefits must be compliant with Parity, regardless of whether the benefits are administered through fee-for-service or managed care. As mentioned previously, members covered by the ABP receive their services through the managed care system, and the ABP benefits mirror the state plan benefits. Therefore, the department has determined the ABP is compliant with Parity. Through the benefit mapping process, the department has determined that all long-term services and supports administered through HCBS waivers fall into the medical surgical benefit category. The department was required to analyze any financial requirements, quantitative treatment limitations, and aggregate lifetime and annual dollar limits that would restrict access to a MHSUD benefit more so than a medical surgical benefit. The Community Behavioral Health Services Program does not utilize any of these limitations for MHSUD benefits. Therefore, the department is compliant with this Parity requirement. To show compliance with Parity, states were also asked to identify and analyze NQTLs used in their Medicaid programs. This required the department to analyze, as written and in operation, any processes, strategies, evidentiary standards, or other factors used in applying an NQTL to MHSUD benefits in each classification to ensure they are comparable and applied no more stringently than the processes, strategies, evidentiary standards, or other factors used in applying a NQTL to medical surgical benefits in the same classification. Through the final Parity rule, guidance from CMS, and technical assistance provided to the states, the department identified 5 NQTLs that are applied across benefits: prior authorization, retrospective review, network provider admission, establishing charges, and concurrent review. The department divided each NQTL into each of the 4 benefit categories: inpatient, outpatient, emergency, and pharmacy, and provided questions to the MCOs and the BHOs to review and analyze how and when the NQTLs are applied. The department also had to review and operationalize the availability of information regarding MHSUD benefits. There are 2 requirements under this section. First, the criteria for medical necessity determinations must be provided upon request to members, potential members, and contracting providers. The department is currently working with its managed care plans to determine the best way to make this already public information more easily accessible. Second, the reasons for any denial of reimbursement or payment of a MHSUD benefit must be made available to members. This is accomplished through the new managed care regulations. The department has created a standard notice of adverse benefit determination for the BHOs to use when denying a service or payment for a service. This notice contains the reasons for the denial and is sent automatically to members. The last step of the analysis is documentation. The department's final analysis was posted on its website on October 2nd, 2017. It can be found under the Regulatory Resource Center, along with this presentation and other Parity-related information. This analysis includes the required elements for Health First Colorado, ABP, and CHIP Plus plans. As previously mentioned, Colorado's CHIP Plus MCO plans are fully comprehensive, which means they provide both MH, SUD, and medical surgical benefits. Per the final rule, each MCO was responsible for conducting its own parity analysis, with the department making the final compliance determination. Moving forward, here are some next steps the department will take to ensure ongoing compliance with parity. CMS requires each state to submit a CHIP Plus state plan amendment to demonstrate continued compliance with parity. The department is currently undergoing this process for submission by the end of this fiscal year, June 30th, 2018. The department has posted responses to some frequently asked questions on its website. If you would like more information on the parity rule, where you can find information on your benefits or other questions, please visit the Regulatory Resource Center on the website for more information. If you have questions or comments regarding parity, the department has created a web form to submit feedback directly to the department. This web form can be found in the department's Regulatory Resource Center under Mental Health Parity. To submit feedback, please visit www.colorado.gov/hcpf/regulatory-resource-center. As a reminder, please do not submit any personal health information through this form. While the department may not be able to respond to every question or comment, the department will use the feedback provided to develop periodic frequently asked questions for posting on the website. We thank you for your interest in parity.